Welcome everyone. I'm Dr.shil. Today I will discuss some previous year questions of AIIMS Patna 2023. Let's start. Today's first question is trisomy 21, which is the presence of an extra chromosome 21 produced by non-disjunction, is seen in which of the following condition? Option A, muscular dystrophy. Option B, cerebral palsy. Option C, Down syndrome. Option D, intellectual disability. Here, the correct answer is option C, Down syndrome. In Down syndrome, one chromosome is just extra due to non-disjunction during meiosis. Non-disjunction during meiosis. In others option, muscular dystrophy is a it's not a chromosomal defect. It's a genetic mutations in dystrophin or related protein. In cerebral palsy, non-progressive motor disorder from perinatal brain injury. So next come to question number 2. The ability to perform low intensity repetitive total body movements over an extended period of time is referred to as. Options are option A, postural stability. Option B, cardiopulmonary fitness. Option C, muscular performance. And option D, mobility. Here, the correct answer is option B, cardiopulmonary fitness. In postural stability, balance and core control against gravities happen, not repetitive total body movement. In option C, strength, power, or endurance of isolated muscles are uh, occur, not whole body sustained. And in mobility, basic locomotion or joint range of motion, low intensity, repetitive, extended. So next come to question number 3. Which of the following is not an example for free exercise at metatarsophalangeal joints? Option A, sitting, toe parting and closing. Option B, inclined long sitting, alternate foot dorsiflexion and plantar flexion. Option C, sitting, drawing up, stroking under medial longitudinal arch. Option D, in sitting, toe flexion extension at these joints, which pressures on balls of the great toe. Here, the correct answer will be option B. In inclined long sitting, alternate foot dorsiflexion and plantar flexion. Why? Because foot dorsiflexion and plantar flexion not occurs in the metatarsophalangeal joint. Rest of the movements occur in the metatarsophalangeal joint. In actually, dorsiflexion plantar flexion occurs in talocrural joint. Next, come to question number 4. Any loss or abnormality of psychological, physiological, or anatomical structure or function is known as option A disability, option B retarded, option C handicap, and option D impairment. So the correct answer is option D impairment. In my previous videos, I have already discussed what is disability, what is impairment, and what is handicap. Actually, impairment is a loss or abnormality of a body structure or physiological psychological function. Example, missing a limb, vision loss, cognitive deficit, etc. Disability is a restriction or lack of ability to perform an activity in a way or range considered normal, resulting from a impairment. Example, difficulty in walking, seeing, or talking. And handicap is a disadvantage experienced in society due to an impairment or disability, limiting the fulfillment of social role. Example, being unable to work due to inaccessible transport or social exclusion. Next, come to question number 5. Stirrup splints are used for which region? Option A knee, option B foot, option C ankle, option D shin. Here the correct answer is ankle. Generally, stirrup splint is a U-shaped splint, so it allows um, some movement in foot but not in ankle joint. Basically, it is a mediolateral wrapping. Next, come to question number 6. Which of the following is not a part of forebrain? Option A basal ganglia, option B thalamus, option C cortex, cerebral cortex, option D cerebellum. Uh, forebrain, fore, forebrain or prosencephalon includes telencephalon, forebrain includes telencephalon and diencephalon. Telencephalon is sorry mm, forebrain is phalon and telencephalon is cerebral cortex and basal ganglia, and diencephalon is thalamus. Sorry, I have written in the previous question. So here the answer will be option D, cerebellum, because all of these are part of forebrain. Telencephalon is basal ganglia is a part of telencephalon. Thalamus is a part of diencephalon, and cerebral cortex is also telencephalon. Next, come to question number 7. Which of the bone cells are the mature bone cells and cannot divide, which maintain and monitor the tissue of its daily metabolism? Option A, osteoblast. Option B, osteoclast. Option C, osteocytes. And option D, osteogenic. Here the correct answer is osteocytes. Option C, osteocytes. Actually, osteocytes are uh, terminally differentiated from the osteoblasts, uh, embedded in matrix. They sense mechanical stress, regulate uh, remodeling via uh, canaliculi, but not proliferate. It can't proliferate. But uh, osteoblasts can. Osteoblasts can. Okay. Uh, Osteoclasts are bone remodeling. Uh, it's also proliferate. Hmm. Osteogenic is a stem cell. Next, come to question number 8. Non-fluent aphasia is a option A, sensory, option B, anomic, option C, global, option D, motor. Here the answer is option D, motor. Non-fluent aphasia is occurs due to the uh, affected area will be Broca's area. Sensory is due to Wernicke's area, and global is both combined of motor and sensory. Next, come to question number 9. Which of the following modalities works on the principle of conduction process? Option A, whirlpool. Option B, shortwave diathermy. Option C, fluidotherapy. Option D, paraffin wax bath. The answer is paraffin wax bulb. Because mm, other options, Whirlpool is uh, con basically convection. Shortwave is also convection. Sorry, shortwave is conversion. Conversion. Shortwave is conversion. And fluidotherapy is convection. Next, come to question number 10. Dash is the valve through which the blood flows to the left ventricle and cannot go back up into the left atrium. Option A, mitral valve. Option B, tricuspid valve. Option C, pulmonary valve. Option D, aortic valve. Here the answer is option A, mitral valve. Here is the picture of mitral valve. The only valve which have the two cusps. Other valves of heart all have three cusps. The only bicuspid valve is mitral valve, which present between left ventricle and left atrium. This is left, this is right. Tricuspid valve, this is aortic valve, and that is pulmonary valve. Okay, come to the next question. Which is the motor area for speech? I have just discussed the Broca's area, which denoted by area 44 and 45. This is the area called Broca's area. This is motor area and this is premotor area. Next, come to question number 12. Which of the following is not a valid classification of sprint? Option A, serial dynamic. Option B, serial static. Option C, static. Option D, dynamic. Here the answer is serial dynamic. There is no such classification present called serial dynamic. Next comes question number 13. Which of the following is not a type of massage classified on the basis of character of technique? Option A, vibration. Option B, percussion. Option C, deep massage. Option D, stroking. Here the answer is deep massage. There is nothing called deep massage. Uh, you can say deep friction massage. Stroking is effleurage. Mm, Percussion is tapotement. Tapotement. Next, uh, come to question number 14. Dash is a reflex in which, when the baby's foot is stroked, the toes fan out and then curl. Option A, rooting. Option B, grasp. Option C, Moro. And option D, Babinski. It's a very easy question. The answer is option D, Babinski. Normal below 2 years. Moro reflex is a startle. Arm abduction, extension. Grasp is palm pressure. Then finger flexion. Rooting is cheek stroke, same sided. Mouth turn, mouth opening or feeding reflex. Next, come to question number 15. Which of the following is the third component of the disablement model? I have also discussed in previous video. This is uh, option B, functional limitation, Nagy's model. One is pathology or disease. Two is impairment, or you can say symptoms. Functional limitation, or you can say activity restriction. Option 4 is disability or participation. Next, come to question number 16. Which of the following is not a feature of sauna baths used as therapeutic modalities? Option A, a dry sauna induce, induces sweating and is used for uh, insomnia, tension, and removal of toxins. Option B, it is a hot air bath with temperature between 160 to 180 degree Fahrenheit. Option C, the client can remain in it for 20 to 30 minutes once per week. Option D, it is a hot air bath with 100% humidity. Here the correct answer is option D, because in sauna bath the humidity is low, very low, that is less than 10%. So actually 100% humidity is used in steam bath. It is used in steam bath. It is wet. Next, come to question number 17. The entire external surface of the bone is covered by a tough, dense fibrous sheath called option A periosteum, option B articular cartilage, option C medullary cavity, and option D endos endosteum. The correct answer is option A periosteum. Articular cartilage is basically present in between the joints, that is type of hyaline cartilage. Central bone marrow is present in the medullary cavity, and inner lining is endosteum. Next, come to question number 18. Which of the following is incorrect about the diastole phase in the right heart, that is right atrium and right ventricle? Option A, deoxygenated blood from the superior and inferior vena cava flows into the right atrium. Option B, tricuspid valve prevents the blood from flowing back into the right atrium. Option C, the atrioventricular valves close and semilunar valves open. Option D, the atria and ventricles are relaxed. Here, the correct answer is option C, the atrioventricular valves close and semilunar valve open. This occur in systole. Actually, uh, this is right atrium, this is right ventricle. In systole is a contraction phase, and diastole is a relaxation phase. So in diastole, this tricuspid valve is open and it is also called feeling phase. So the option, the atrioventricular valves closed and semilunar valve open, is a wrong one. Next, come to question number 19. Which of the following is not a thermotherapy application? Option A, spinal packs. Option B, whirlpool bath. Option C, cryokinetics. And option D, shortwave diathermy. Here, the correct answer is cryokinetics. Is a cold therapy. Next, come to question number 20. Dash is a physical therapy modality used to manage acute and chronic pain in physical therapy, in which the intensity of the electricity will be adjusted to block the painful signals traveling from the body to brain. Option A, iontophoresis. Option B, cryokinetics. Option C, TENS. And option D, NMES. So here the answer is very easy, that is TENS. Thank you everyone. Please do like, subscribe, and share my video, and everyone please comment on the video. What should I discuss on the next video? Thank you.